Hi there, Grant Blashki here from FamilyDoctor.expert. Today we're going to talk about sleep problems, very common. About a quarter of people say they don't get enough sleep, and in any one year about half the population say that they've had some problems with their sleep. Now, they're not trivial. If you're not sleeping, it can cause problems at work, can make you a dangerous driver, or if you're operating machinery. It also can be a sign of disease. Either some mental disorders often present with sleep problems or some underlying physical disorders, particularly one that we like to look out for called obstructive sleep apnea, particularly amongst people who are snoring a lot. This is important to pick up because there's lots we can do about it, and it's quite serious if we just let it go. Normal sleep requirements vary greatly between people. Generally, young people need about 7 or 8 hours sleep, but as we get older, we may need a lot less sleep than that. Different phases of sleep, the rapid eye movement, or what's called the REM sleep, is the dream sleep, and the non-REM sleep is different stages that you go through, 1, 2, and 3, as you fall off to sleep. Now, there's lots of things we think about when people say that they can't sleep. First of all, we wonder, could it be stimulants? I'm always taken when I ask people, they say, I can't sleep, and I go, how much coffee are you having? And they go, well, 6 cups a day. So think about stimulants. Coffee, nicotine, alcohol can also cause problems with sleep. Think if you're taking any medications, antidepressants, particularly a group called the SSRIs or one called venlafaxine can make it difficult to sleep. Some of the asthma medications can be quite stimulating, steroid medications, some of the cold and flu medications. So have a chat with your doctor if maybe there's something you're taking that's making it difficult to sleep. But by far and away, the most common that we see is stress, and people worried about money worries or conflict at work or conflict at home, very common. Or sometimes people have developed depression or anxiety, and this manifests mainly as not being able to sleep. So the other thing the doctor will want to do is make sure it's not some underlying physical disease. We check for obstructive sleep apnea, which I've mentioned. And depending on the symptoms, some people get very twitchy legs, a thing we call restless leg syndrome, which drives them a bit crazy, but there's things we can do about that. Are they breathless at night? Definitely let your doctor know. Double check your heart, double check your lungs. A hormone problem called hyperthyroidism is something a doctor can check on a blood test, and this will make you have a lot of trouble sleeping. In the fellas, prostatism, prostate problems, getting up to wee lots and lots at night, that's another common problem of sleep issues. The other people who run into trouble are those who have disrupted their body clock. Shift workers, people who get jet lag, people who aren't getting much natural light, getting out in the sun every day can have sleep trouble. So generally your doctor will ask you to keep a bit of a record, a sleep diary, to see what's going on with your sleep. And some of the tips for sleeping are pretty obvious, but anyway, cutting back coffee, preferably don't smoke, but if you do, cut back your ciggies, less alcohol, try and wind down for an hour or so before you sleep. I mean, the big thing for this generation is the amount of stimulating technology, phones and tellies and iPads and all that stuff. So make a time that you're going to switch that off, maybe 11 p.m, no more technology, and just wind down before you go to sleep. Make sure your bed's comfortable, make sure that you haven't got light coming in, that you haven't got any noise disturbing you, comfortable pillows. So all these little things you can do add up and can help you get to sleep. Now what if you can't sleep? You're lying in bed, tossing and turning, worrying. Better to get up. If you can't sleep, get out of your bed, go and sit in another room, preferably not playing on the computer or anything stimulating, maybe some reading, maybe a cup of warm milk, maybe write down the things you're worried about on a list for the morning, and then when you're tired again, go back to bed. But we want your body and your mind to associate sleep with the bed. So if you're tossing and turning, then that's not what we want. You can, if you're having a lot of trouble, speak to a psychologist about what we call cognitive behavioral therapy and have a look at how you're processing things and worrying about things, and that can be very helpful. other approaches such as mindfulness, hypnosis, structured problem solving, or even just those simple audio relaxation music or relaxation programs are very helpful. There's obviously a bunch of medications that your doctor could use to help you sleep. Main worry with these is they're a bit addictive. Generally, they're just for short-term use only. There's a few different groups, what we call the benzodiazepines, things like temazepam, and then the non-benzodiazepine drugs, zopiclone, zolpidem, a few others. But all of these have got side effect profiles which your doctor will talk about with you. So there's a whistle-stop tour about sleep. As usual, don't make any decisions based on this video. This is just a general guide. Speak to your doctor. Wish you well. I hope you get a good sleep from FamilyDoctor.expert.